If you're using phrases in your documentation, you could be setting yourself up for denial and not even know it. Today I'm going to show you 5 common charting phrases nurses use every day and exactly what to say instead to protect your documentation. Here's the truth. Most nurses aren't charting wrong. They're just using the wrong words. Small wording issues can completely change how your documentation is interpreted. Let's start with one of the most common. Patient tolerated well. Sounds fine, but this tells Medicare nothing. What did they tolerate? How did they respond? Say this instead. Patient completed exercises with mild dyspnea, requiring rest breaks and cueing. Now that shows patient response and skilled intervention. Next, weakness. You see this everywhere, but it's not measurable and it doesn't show impact. Say this instead. Decreased lower extremity strength, 3 out of 5 affecting safe transfers. Now you've made it objectable and tied to a function. Here's a big one. Patient educated. This is one of the most overused phrases in home health, and it does not prove teaching actually worked. Say this instead. Patient able to verbalize 2 fall prevention strategies. Now you've shown learning, not just teaching. Let's talk about stable. A lot of nurses think if a patient is stable, it weakens their note. Well, that's not really true, but your wording matters. Say this instead. Patient stable but requires ongoing skilled monitoring due to risk of CHS exacerbation. Now you've connected stability to risk and justified your visit. Last one, no issues. This one seems harmless, but it actually can hurt you because it sounds like there's no reason for skilled care. Say this instead. No acute changes noted, continuing monitoring required due to high-risk status. Now you've protected medical necessity. Do you see the problem here? It's not about saying or using fancy words. It's about being specific. Stop being vague and start showing exactly what's happening with your patient. Because here's what Medicare is really asking. They're not asking, did you provide care? They're asking, did you prove skilled need? And your wording is what makes the case. If you want more examples like this, I put together a full list of 40 documentation fixes you can use while charting. Exactly what to avoid and exactly what to say instead. Click in the link in the comments. And if you want to get better at documentation without second-guessing yourself, make sure you follow because I break this down every week.